So physical therapy, your therapist can help you improve strength and mobility and through developing an regular exercise program. Sometimes TENS units are available. The idea is that you place 4 electrodes on your body, and then that will actually create an electrical sensation, which will block the electrical sensation coming from your body, in theory, to result in less pain that you experience. So some of the over-the-counter medications that you can use, Tylenol or acetaminophen is a medication. It doesn't have any anti-inflammatory effects, though it can be somewhat helpful. NSAIDs or non-steroidal anti-inflammatories like Advil, Motrin, Aleve, those can be beneficial for modest pain. You just want to use caution if you have any type of risk for bleeding in your GI tract or any kidney dysfunction. And also, if you're using these on a daily basis, then it may be time to talk to your healthcare provider to see if there's some better options out there to control your pain. Again, medications. Many times we use anti-convulsant medications or anti-epileptic medications, and what that does is that helps to slow the impulse across the nerve so that it results in a decrease in pain. Gabapentin and pregabalin, or Neurontin and Lyrica, are 2 of the most common medications used. Many times they come with side effects such as sedation, mental clouding. Topiramate or Topamax can cause some confusion. It's sometimes used as Dopamax because it can cause some cognitive dysfunction. So if this is a medication that you begin through your healthcare provider, you just want to be aware of your mental effects after starting medication. And with any medication, if it's not effective, then you shouldn't use it. You should have an open dialogue with your healthcare provider to see if there are other options available. The main side effects of all of these medications that I mentioned are basically sedation, though the sedation effects of these medications will lessen many times the longer you're on them. Mental clouding and sometimes dizziness will occur. It's also important to note that it takes time for these medications to build up in your system, so don't expect that after you take the first couple of doses that it's going to be effective, and you may need titration up with the direction of your healthcare provider to get the desired effect. Avoid alcohol because this can contribute to the sedation and mental clouding effects of these medications, and very important to not stop these medications abruptly. You want to, again, have an open dialogue with your healthcare provider on how to do this if you want to wean off of some of these neuropathic pain meds because they're not as effective as you would like. Antidepressants is another class of medications that we often use with neuropathic pain because depression and pain many times go hand in hand. These first 2, amitriptyline or nortriptyline, at use at higher dosages, you get the antidepressant effects. At lower dosages, it has been useful for chronic pain. The problem with these is they have many side effects. They can cause anticholinergic effects, which basically means it dries things up. It dries your eyes, dries your mouth, can constipate you, and even cause urinary retention. Sedation, again, is a main side effect of these medications as well. Some of the newer antidepressants, such as some duloxetine, venlafaxine, or Cymbalta and Effexor, can be very effective. Studies have shown that used at higher dosages, you really don't get that much more effect on pain management. They usually have less side effects than the others that I mentioned above, but it can affect your libido, so that's a concern for many. Now, these are thought to block sodium channels, which can stabilize the nerve membrane. They typically have minimal side effect and can have modest results. You use lidocaine patches. That's for a very localized area of pain. You put the patch on for 12 hours and then you take it off for 12 hours. Capsaicin gel is something that you can purchase over the counter that may be beneficial and again has very few side effects, so it's something that you can absolutely try. You want to avoid opiates in most cases because they're not, several reasons. They're not usually effective. They can be habit-forming. They have many side effects listed there, such as sedation, confusion, constipation. And then when you come off of these medications, many times it can be very difficult and you'll have a rebound or an increase in the amount of pain level. Just as a side note, in our clinic, we typically do not prescribe opiates because reasons stated above. They generally just don't work for long-term pain management. There are many other options out there. Again, one final thought before I turn it over to Melissa is you really want to evaluate whether your medications for pain are working for you. And if they're not, then you should talk with your healthcare provider and see if there are other options that are available. And don't do anything on your own. Be sure you go under the direction of your provider. And I think that's it.
Okay, so muscle pain and spasticity is what we're going to talk about next. Spasticity is a result of damage to the central nervous system. It causes an abnormal signal or impulse to be sent down into the muscle fibers, resulting in a contraction of the muscle belly itself, and it makes it difficult for the muscle to relax. Typically, we hear about spasticity in the arms, legs, and low back. It's intermittent in nature. It may be constant at times, but usually it relaxes and remits. Also, it's typically worse at night. When patients are laying in bed, typically we hear that is when the most severe spasticity occurs. Often occurs with prolonged sitting or standing in one position. Can be triggered by rapid movement. Spasticity uses up energy, which is going to lead to muscle fatigue. Exercise is beneficial, and we'll get into that more later. So 3 out of 4 patients experience spasticity. Typical words that we hear spasticity is described as aching, throbbing, tightness, cramping, or jerking sensations. Treatments for spasticity. First of all, the goals are to improve mobility and flexibility, to reduce pain, and maintain and improve strength and coordination. You want to be stretching daily, and also what can be effective is developing a physical therapy program. And this can be done with physical therapist at their rehab center, or the PT can develop a home program for you. Also, hydrotherapy is highly effective. There is also medication management, and we'll get into that a little bit more too. Non-pharmacological treatments, move, get up and get active, which we've tried to emphasize throughout the day here. The best exercises you can do for yourself are listed here: yoga, Pilates, and Tai Chi. That crossing of the hemispheres leads to rebuilding of nerve fibers and axons that have been lost. Heat therapy can also be beneficial at relaxing the muscles. Non-pharmacological stretching exercises. Again, as I talked about, you can develop this with your physical therapist. It can consist of hydrotherapy, low resistance exercises, and low impact on joints. Stretch. We want to emphasize that you should stretch. I typically tell my patients before they get out of bed in the morning, and then before getting in bed in the evening. Here's some demonstrations of exercises for the hamstrings. All these exercises and stretches can be modified for persons in wheelchairs or that are unsteady in their gait or are off balance. So here's just a couple examples for the hamstrings. And it can be recommended to hold for 30 seconds to 1 minute at a time. And you want to hold the stretch for 30 seconds to 1 minute, relax, and then repeat 2 to 3 times each leg. Calf exercises can be used with a step, or just resting up against a wall with just your foot, as the picture demonstrates on the bottom here, or using your hands and pressing towards the wall to get an effective stretch on the calf muscles. The hip, you have a lot of muscles in your hip. You have internal and external rotators, abductors and adductors in your iliopsoas muscle. So here's a couple examples of stretches that can be very beneficial for especially low back pain. This guy with the hat on in the top left, if you are able to get into that position, that's a very good stretch for the low back as well. Aggravators, just the same as we talked about previously. Extreme temperatures, many MS patients are heat sensitive, although there is the alternative where patients may be cold sensitive and the heat doesn't bother them that much. Humidity may be a bothersome agent. Prolonged sitting or standing can increase spasticity. Infections, especially urinary tract infections, if you're experiencing an unusual amount of spasticity for your baseline, and you may or may not have symptoms related to urinary tract infection, you may want to see your provider to get a UA done and get a sample tested, because that may be an indication that you do have a urinary tract infection. Same with upper respiratory infections and other serious infections, maybe sepsis from an untreated urinary tract infection. There are medication managements for spasticity. Baclofen, which most of you have probably heard about. Tizanidine typically causes more fatigue than baclofen, but some patients are able to tolerate it just fine. There also are the benzodiazepines, which are used for multiple reasons, seizures, anxiety disorders, sleep, and now we can use a couple of them that have been shown to be effective for spasticity. Dantrolene there, the last one, dantrolene listed. We do need to be careful with that medication, as you do need to have liver function tests tested regularly, because it can have a potential serious effect on the liver. Typical side effects of these medications include sedation, dizziness, and weakness. Moderate to severe spasticity. Nowadays, Botox injections are getting more and more recognized, and insurances are starting to approve that as well. You inject the Botox into the muscle belly. There is a specific protocol you follow. We do not inject Botox at our clinic, but we have providers in the neurology clinic that we refer you to, and Botox lasts for about 3 months. And that's 3 months until you have to get another set of injections. Intrathecal baclofen, this is for severe spasticity. When a patient has reached maximum doses of the oral antispasmodics, there may be a place to do an intrathecal baclofen pump, which is completely under the skin and implanted by a neurosurgeon and delivers continuous baclofen into the intrathecal space. Splinting or bracing, surgery, tendon release can be effective, although we typically see this in very severe cases and more often in CP patients, cerebral palsy patients, and the baclofen pump, as we talked about. In conclusion, pain is commonly seen in MS. There are many different approaches to pain, conservative measures, and non-pharmacological measures, as well as medication management when the conservative measures fail. Be sure medications are having a benefit. You should not be taking a medicine that you don't think is working because of the potential side effects that it can have on your kidney and liver toxicity. So talk with your healthcare provider and say, hey, I don't think this is working, can we try a different agent? In some cases, it may be difficult to become actually pain-free, but don't get down on this statement. There is hope that we can definitely relieve your pain and get it down to a more tolerable level. Also, be sure to keep an open dialogue with your provider regarding your health, especially when your pain is affecting your daily activities and your activities of daily living, and sleep patterns especially. So, thank you.